I remember one of my kid was born, and then I had my first like expired newborn come in, and the way they had framed it in the announcement, that they're so and so's coming, it sounded like it was like premature, a
Mm,
premature birth, and it
yeah.
turned out it was a full term baby that the 14-year-old girl had in the shower, got freaked out, let the uh, left the kid on the floor of the shower with the water still running. By the time the EMS got there, they had already had to start like, the kid was already having a heart attack. Um,
Resuscitation and all that. Yeah.
they're doing all, yeah, right on the spot. So when I see this, I'm thinking, oh, premature, it's tragic. But there's something about like if it's 20 weeks or 22 weeks, it's like, life can be really unfair. But when you see a full term kid like that, and it was just a matter of like just circumstance like that.
How do you deal with
Yeah.
that trauma? Like, what are some ways that you cope after seeing a experience like that?
To continue that story, it was kind of um, the child comes in, and some of the nurses were freaked out, and so I went right into taking over compressions, because people were a little bit, even the nurses were a little shocked. And the baby, she had these beautiful eyelashes, and it was a beautiful child, but it was kind of freaky to see a baby with um, like no baby smell, cold, the skin. It almost seemed like a realistic doll. And
Blue.
then on top of that, the I never that one of the people of the cleaning crew actually started getting into a fight with the doctor, because then after they called it, the doctor wanted to do a sort of, because there was no parent, there was no family I'm not that it meant anything, but he wanted to kind of do a training thing, because you
Yeah.
don't get patients like that often. And the housekeeper had took great offense to that. And then there was also the situation with like concept of ambulances, where not too far away was a hospital with where their ER, they had a pediatric specialty. Like they were known for having outstanding pediatric care. And so a lot of people were like, well, why would you take her here? And it's like, well, this was the closest hospital. Even if
Yeah.
not too far away was there was a crew there, and a system in place to really care for this
Yeah.
patient, perhaps a better outcome. Even though I think the outcome that ultimately transpired was inevitable because of the condition. And then on top of that, so the mom comes in with the daughter, and then because of the what the mom had said and what the daughter kind of wasn't saying, there was suspicion that it could be incest, and that might have been part of why this girl was trying to keep it all a secret. And I don't know what happened with that story, because I had become a travel nurse, and left ultimately. And then
Yeah.
the grandparents came in, and the charge nurse, I guess, got a talking to, because the grandmom took the baby, and while the grandfather was parking, she left the room with the baby and started introducing to all the patients her lovely, wonderful granddaughter, as if this was a live baby. So all these things are happening, and you're just watching, you're experiencing it. The code didn't go well. You're like, the grandma is introducing this dead child as if it's alive to patients. We got to like deal with this now. Uh,
Wow.
is this a product of incest? I mean, so many things are happening at the same time. And then it's like, well, I also got 10 more patients I got to attend to. The guy who's intoxicated screaming at the assistant. This person is yelling because the CAT scan's taking too long. I got somebody with a brain bleed. I got a chest pain. I got two abdominal pains. This person's getting COVID and they need it's just like, you
It's a
also have
perfect
to do your
example of
job.
like you can't make that up. It's like you
No.
have this circumstance going completely catastrophically wrong. You gotta, as a nurse, you gotta turn that off, and then now it's like you open the next door, you walk in with a smile, hey, what can we do for you? We got to get blood cultures, we got to get an IV in. You got to put
Yeah.
that in the rear view, and now you got to treat this patient from the best of your ability as well.